Hi, I'm Felipe Fernandez del Castillo. I'm a kidney doctor and blood pressure specialist with Reliant Medical Group in Worcester, Massachusetts. I'm often asked by my patients about alternatives to medications for managing high blood pressure. Before I talk about this, I should acknowledge that the ability of blood pressure medications to lower blood pressure safely and prevent heart attacks, strokes, and death is very well established. Most patients with high blood pressure will require at least some medications to lower blood pressure, and not every lifestyle approach will work or be safe for every patient. This is particularly true for people with heart disease, strokes, or kidney problems. Talk to a clinician who knows you well before starting any treatment plan for your blood pressure. That said, I understand many patients' reluctance to start medications, particularly for blood pressure that's only mildly elevated, and I want to review the approaches to lifestyle modification for treatment of blood pressure that have the best scientific evidence. Of all the lifestyle interventions that affect blood pressure, the DASH diet has the best support from real-world evidence. In one study, the combination of a DASH diet with a low-sodium diet reduced systolic blood pressure by 11 points in patients with mildly elevated blood pressure. The DASH diet is a diet that is rich in potassium, calcium, and low in animal protein and fat. For more information on the DASH diet, please visit the American Heart Association website. Sodium restriction is often recommended for patients with high blood pressure. While not every hypertension patient will have a significant drop in blood pressure with salt restriction, many will, and salt restriction may have other benefits, including reducing the risk of stroke, kidney stones, and heart failure. I typically recommend that my patients limit themselves to 2,000 milligrams of sodium per day. That's about the amount of table salt contained in 1 teaspoon. It's important to remember that the vast majority of sodium in our diets comes from prepared, packaged, and processed foods. So it's important to read nutrition labels, look at the amount of sodium in a food, and think about portion size to adequately restrict your sodium. Weight loss has also been shown to improve blood pressure and has many other health benefits as well. Most patients can expect a 1-point drop in their systolic blood pressure for every 2 pounds they use. Exercise, aerobic or resistance, also has a moderate effect on blood pressure, lowering blood pressure by about 5 points. There's really no surprises here. Eating lots of fruits and vegetables, exercising, and avoiding salt can help you reduce your blood pressure to a significant extent. You should always talk to a clinician who knows you well before starting any treatment plan for high blood pressure.